Hello, everyone. Welcome back to Beyond the Practice. Today, we're honored to have a guest who is revolutionizing how we approach behavioral consultation for neurodivergent individuals. Aubry Dodge, the founder of Kaleidoscope Behavioral Services, LLC, is a Board Certified Behavior Analyst with over 2 decades of experience. Her practice is deeply rooted in neurodiversity-affirming and assent-based principles, focusing on empowering individuals to eliminate barriers, maintain autonomy, and increase self-determination. Aubry, thank you so much for joining us.
Thank you so much for having me.
All right. So your journey with Kaleidoscope Behavioral Services, LLC, is built on neurodiversity-affirming and assent-based approach. Can you explain what these terms mean in practice and why they are so crucial in behavioral consultation for neurodivergent individuals?
Absolutely. So when I say my services are neurodiversity affirming, I mean that my goal is not to help make someone neurotypical. My goal is to help the person and those around them to recognize their individual value in the community and for them to live their best life as a neurodiverse person. Assent-based services means that whether the person speaks the same way we do or not, we're listening to and responding to their communication. And if they aren't fully on board with what we're proposing that they do or that we do together in therapy, so like they're showing that they don't assent to or don't want to do it, then we don't do it. So we pause, we work together to figure out what the barrier is, and we make modifications and then ask again. And another important piece is that we don't use coercion. So we're learning together. We're trying to balance the power dynamic. In other words, I'm not in charge. People often will come to me when there's a behavior that is a barrier for them or for their child. And sometimes they want me to make their child act the way the other children are acting, or they want me to make someone do something. And I let people know right up front that that isn't ABA. So assent-based neurodiversity affirming therapy starts with the therapist learning the client's current communication, whatever that is, and responding to that. So the foundation of therapy is to make sure that the client feels seen and heard and that they know and can feel that we're there to learn together. Diversity in all the ways is important and functional in our world. And we do best as people when we learn from each other. So we all have skills that we need to learn to get the most out of our life. And my goal is to help people figure out what those skills are and help them learn those skills. When we have skills, barrier behaviors go away.
It makes complete sense to me. Absolutely. All right. So you've been working with autistic individuals since 2001 now, going on 25 years. So how has the field of behavioral consultation evolved during that time, and specifically in its understanding and support of neurodivergent individuals?
This is a hot button issue, and I'm really glad that you asked it. As you said, I've been in the field for 25 years, and literally almost everything has changed. So our society itself has evolved a lot, right? In 25 years since 19, whatever. And ABA has adapted along with it. So previously we focused on things like compliance or appropriate play skills to make life easier for our clients. However, what we've learned from listening to them was that it felt like we were trying to turn them into something else, which was hurtful. And pushing through their barrier behaviors made them feel unheard and out of control, which was actually traumatizing. And that hurts my heart that happened in ABA, but just as today's parents are attentive and they show care and concern for their children compared to parents in the 80s when we were raised on hose water and neglect.
Oh, yeah.
As a field, we've listened and learned and changed, right? So while it's always been against our code of ethics to use methods like spanking or isolation, some of the procedures we used to use, we don't anymore. And our ethics code is now fully enforceable, and it evolves over time and with wisdom. And we're now required to earn ethics CEUs each year. So not just regular CEUs, but ethics ones. We're learning from clients all the time, and we're always working to improve.
I think that's great. I actually didn't know that ethics CEUs. That's fantastic. Because especially, not you personally, because you've been in the field 25 years, you got this aura, you're great at what you do. But I see in my field, techs that have been 20 years, that they lose the ethical approach. They lose that compassion that they came in with. So having ethics CEUs, I think that's fantastic. That's great.
Yes.
So Kaleidoscope Behavioral Services, LLC, focus on eliminating barriers, maintaining autonomy, teaching self-advocacy, and increasing self-determination. Can you share a specific example of how your approach helps an individual achieve these goals in a meaningful way? And I'm excited for this answer.
Yes, absolutely. So self-determination basically means a person gets to make their own decisions, right? So For example, let's say an autistic adult wants to work full-time in a job related to their interest, and they have all of the necessary skills, like the technical skills to do that job, but they haven't been able to maintain employment due to things like distress tolerance, organization, motivation, communication, or social barriers. One of our first initial goals might be self-awareness. So we'll work together to identify individual strengths and areas for growth relevant to that specific job. And then we determine the skills necessary to maintain employment, and we break those down into manageable goals. It's awesome when someone knows what they excel at, they can pursue opportunities in those areas. And when they understand what they need help with or what they struggle with, they can learn to self-advocate for specific support or adjustments that would then help them succeed in their chosen career. I love my job, and I want that for everyone.
Yeah. If you love what you do, you don't work a day in your life. They told me that a long time ago, and it's came true.
Right?
Yep,
But
100%.
yes.
Yep, absolutely. So, and here's where we get to the stuff I'm really excited about. So, you offer an in-depth training called Autism at the Dentist. What are some of the most common challenges autistic individuals face in a dental environment, and how do these challenges often manifest during appointments?
Great question. So, autistic people often struggle at the dentist because the dentist has not yet been trained or educated on autism and doesn't yet know how to respond to different types of communication. On top of that, autism has an important sensory component that often means the sounds and smells and visual input at the dentist, which is, very different, can be incredibly overstimulating. And when someone's overstimulated, their brain is not able to process information effectively, right? So a dentist is trying to explain something to them and trying to get them to do something, and they're not in a place that they can take any of that in. So they're likely to engage in some sort of behavior that's a barrier to, having a successful appointment. So because of all that, a lot of times autistic people and their parents are likely to avoid appointments at the dentist, and dentists are actually refusing to treat autistic patients. So that's awful, and that makes the entire situation really difficult. And asking people who are in pain to wait months for an OR so that they can be sedated for treatment is not okay.
No.
I've heard of people waiting 36 rounds of antibiotics while they wait for an OR. You know how bad that is for your body because they've got something wrong in their mouth.
Yeah.
So my goal is to teach dentists and doctors to provide trauma-informed care to their patients and to increase access to oral health care services for autistic people.
Yeah. And, I was thinking before we got on here, is the dentist the most avoided medical experience, in neurodivergent individuals? I was kind of thinking, and maybe you can't tell me yes or no, but once I started thinking about it, I'm like, that makes a lot of sense because of these sensory, the stimulating and everything. And furthermore, actually, now this is me just kind of spitballing right off the top of my brain. Do you recommend maybe glasses? Because I'm going back to me, scanning these patients. I always put everything back to scanning, MRI, radiology. But my background, it's maybe glasses, or maybe even some sort of headphones, music, a distraction. Is that stuff that you actually see works in the clinic?
Absolutely, right? Everybody's different, so not everybody needs the same thing, but absolutely. If the bright lights are overstimulating, then sunglasses are really helpful, right? Sometimes a weighted blanket can be helpful, and sometimes the vest that they use for x-rays is weighted, and so sometimes just that laying on their body can be comfortable.
Yeah.
I have a lot of anxiety at the dentist, and my dentist has a comfort menu. So when I get there, they say, "Would you like a fuzzy blanket, or would you like us to turn on the massage chair?" Nicholas, I like the dentist. I used to avoid it a lot, but now I'm like, thank you. That feels, it's really neurodiversity affirming, right? Saying you're different and that's okay. We want to provide what you need to make this possible for you.
I like that. A comfy menu.
Yes, a comfort menu. It comes to a menu.
A comfort menu. That's great. I do. I like that a lot.
Yes. And you're absolutely right when you say, is that the hardest thing? Oral healthcare is number one most unmet healthcare need for people with disabilities.
Oh. That's why these conversations are important. That's why this needs to be out there.
Yes.
So for dental practices, looking to become more inclusive, where should they start? What are the immediate, actionable steps they can take to create a more welcoming and successful environment for neurodivergent patients?
Immediate actionable steps. Talk to your patient.
I love
Whether
it.
they look at you or not, whether they're vocal or not, whether they seem to be paying attention or not. Autism does not mean cognitively impaired. Autistic people are often very good at multitasking. So they might be engaging with some sort of sensory item. They might be making a vocal noise and listening and understanding what you're saying without looking at you. Ask permission to touch them. Thank them for cooperating. And then the next point I have is about the environment, like you talked about. Would sunglasses be good? Would a blanket be good? Evaluate your environment in terms of sensory input and think of ways to adjust that to make, for patients to make it more comfortable. One time I went into a dentist office and they were like, we just built this. It's so beautiful and let us show you. And I went in and he was talking and it was echoing so loud in the room that I was uncomfortable. And I'm not sensitive to audio sound, noises. So I was like, we need to. So what they did is they put things in the room to make it so it doesn't echo anymore, right? You can ask your patients to bring in a comfort item with you so they can hold it while you work. Allow them, here's one that I really love. Allow them to watch their siblings or caregivers before you do their appointment. So that often brings down a lot of anxiety because then it becomes predictable.
Yeah. I use that on my children. Watch daddy do it. Watch daddy do it first. Yeah.
That's it.
Yeah. No, this is all fantastic stuff, all hitting at home. So what role do parents or caregivers play in preparing a neurodivergent individual for a dental visit, and how can dental teams best collaborate with them to ensure a positive outcome?
Love that. I love that question. So ask caregivers how your patient communicates, their willingness or lack thereof, and respond to that immediately by backing off if necessary. So if your client comes in and you've asked their caregivers ahead of time, what does it look like when he's uncomfortable? And they say like he pulls back a little and like squints his eyes, then you know what that looks like, right? I used to have a client who would do this when he was excited. And so I remember one time the ambulance came. He had a seizure, and the ambulance came. We had to get him on in the ambulance, and he's non-vocal. And I had to tell the ambulance people, if he does this, that's a good sign. That means he's okay. Because I worried like he'd get in there and they wouldn't understand this. So like you have to ask the people who know them really well, what does it look like when they're comfortable or not comfortable so that you can respond to that? Because if you're getting some sort of barrier behavior, never push through barrier behavior, right? Because barrier behavior is communicating something about your treatment. Like it's the same as me saying, please stop, I'm scared. Right? If I said that, I'm scared, you would stop immediately. And so when they're making a noise or doing something with their body, imagine that that's probably what they're saying too, and stop and make an adjustment before you ask them to try again.
Makes sense. And I don't know how you feel about this, so I'll put it out there. Always going back to my own experience, right? Because I find that sometimes the caregivers and the parents, it's either that they're your best ally or they're also the biggest obstacle. Yeah. And I hate to say it that way, but it really is the truth. And do you find that also, in the dental clinics?
Yeah, that's absolutely. So, and I feel, I have empathy for all of them, right? Because they're coming in as a caregiver and sometimes they're having to drive really far to get to this dental appointment because their local dentist will not accept them. And their child has been in pain, or their child has not been willing to let them do their, brush their teeth. And they get to the dentist and they're not cooperating, but the dent or the parent is like, please just get this done, do whatever it takes to get the work done because it needs to be done. And I don't want to come back here again. It's so hard to get him here, right? Like and that's true. It is so hard. So sometimes having to tell parents, and I tell them right up front, I teach my dentist to tell the families right up front, I'm going to treat your child. I'm going to work with your child. I'm not like the other places they're going to say no, right? So I want to know what kind of challenging behaviors we might be dealing with, what their communication is like. And if they are not ready for this appointment today, I'm going to let them go home. I'm going to stop, right? I'm going to stop wherever I need to stop to not push them overboard. I'm not going to push them to a place of like, where they're really upset and really distressed. I'm not willing to do that. So when they show me a little bit of assent withdrawal or like I'm not comfortable, I'm going to respond to that. And that might mean I'm going to end this appointment early. And so parents sometimes struggle with that. And so I tell them, but ahead of time, just know before you come that we might not get everything done, and that's okay because we're more likely to get it done next time if we're, patient with them today.
I have way too many of those experiences where it's like, no, like they were holding still, keep going. It's like, I'm not continuing this scan as I hear that baby crying hysterical. Okay, I'm seeing the motion. This is torture. We're not, let's try again. But like you said, let's reset, go back to the room, do whatever it may, that relaxes them. If it's nowadays, it's normally an iPad, something like that. Let's get them back to where, and then we'll come back and we'll try this again.
Yes.
And it's hard, and sometimes it's difficult for the parents to
that helps. That what you just described is preventing traumatization at the doctor or the dentist, right? When we push through that stuff, that's where we are traumatizing someone. So I'm glad that that you did that.
Yeah, and it's baby steps, right?
Yes.
What's connected. I'll get away from my field. Even in the dental clinic, right? Let's pick out a toothbrush. Boom. Let's do something like that, or let's just get the patient to sit in the chair.
Yes.
Celebrate the small wins.
Yes.
Right? This is the way we get there to the bigger picture.
Yes.
That's why I love this conversation. I love everything that you're doing. It absolutely is incredible. So I'm Team Aubry over here. Team Aubry for sure.
Thank you so much. I also recommend that dentists work or follow the American Academy of Developmental Medicine and Dentistry.
Okay.
I'm on the behavioral health task group for them. It's a great group to get involved with and also get training. I have a CEU coming out soon in collaboration with Delta Dental. So
that's great.
Get training, dentists.
Listen, when that comes out, you can give me that website. We'll put all that stuff in the link of the chat below, the comments below, so everybody has it available. All right.
Thank you.
So now we're going, shifting a little bit away, but back to, your story. So what inspired you to start Kaleidoscope Behavioral Services, LLC? And what is your ultimate vision for the impact that you want to make on the neurodivergent community and beyond that?
I founded Kaleidoscope Behavioral Services, LLC, because I saw a huge gap in much needed services for autistic adults. So according to the DSM, a diagnosis of autism means that a person will need a level of support throughout their life, but the support seems to disappear at the age of 26 in our current American education and health system. And I want to be part of the solution for that. Like we talked about earlier, the number one most unmet healthcare need for people with disabilities is oral healthcare. And this has a massive impact on someone's life and well-being. So, I've went to the New York University Oral Healthcare Center for people with disabilities, and I saw a young woman who was 14 have to have most of her teeth removed. And that was devastating.
Yeah.
That is not, to be 14 years old and not have any teeth anymore for the rest of your life that's devastating. So I want to help bridge this gap.
And then there's a need for it. There's an absolute need and demand for it. And that's, we got to open their eyes. We got to get everybody out of the norm. So,
yeah.
And maybe you kind of touched on it a little bit, but, just for parents, caregivers, and even neurodivergent individuals themselves who are seeking support, what advice would you offer them in finding a behavioral service provider that truly aligns with their needs?
Ask a lot of questions and follow your gut. So if they talk about compliance or making you fit in or healing you or fixing you, run. That's not the right place. That's not good for you. That's not what the world needs.
It's 100%. Asking questions is the best thing that you could do in a situation like that.
Yeah.
And now looking ahead a little bit, what's your vision? What is Aubry Dodge's vision for the future of dental care? For neurodivergent individuals, what changes do you hope to see become the standard of practice, and anything else that you really want to see, in these dental clinics?
It's really simple. My vision is that every dental office should be able to provide trauma-informed care to autistic individuals and those with other disabilities without the need for sedation and restraint.
Yeah.
That's it.
It's short, it's sweet, it's simple, and it's
reasonable. Right?
Absolutely. It goes back to just having the patience, taking the time, understanding it. And, even if you book in, 15, 30 minute appointments, neurodivergent patient coming in, let's make it an hour.
Yes.
Let's bump it up. Let's give some more buffering time. And I'm sure you have people that you can fit, but let's give them that time. You can't make them feel rushed. Like you said, it's about the comfort. It's about not pushing through barriers or when to recognize them. And
Yeah.
it's all making sense. Perfect to me. Everybody else in the world, you got to hear it. You got to listen. Put your
Thank
best
you.
foot forward and let's get this done.
Right? It's
Yeah.
time.
Yeah. And now I'll give you one last chance. I appreciate your time. I appreciate everything. I think it's a great conversation. Anything else, where can people follow you? Where can people learn more? LinkedIn, socials, website. This is the platform. Let them have it.
Thank you so much. Yeah. So you can find me on LinkedIn, Kaleidoscope Behavioral Services, LLC. The website is kbsconsultation.com. You can email me at Aubry, D-A-U-B-R-Y-D at kbsconsultation.com. I will be hosting a CEU soon with Delta Dental. So you should be able to find that one on Delta Dental's website, their foundation website, coming up. And I don't yet have social medias like Facebook and Instagram. I have avoided those for the last few years personally. So I'm trying to get into them professionally. I'm still working on that, but more to come.
More to come. That's it. And like I said, I can't thank you enough for the time and just having this conversation. We're at the 22-minute mark. It's as easy as that. It's as easy as the conversation and getting it out there, because these aren't difficult things to do. This is something, and we're in the healthcare, medical practice. They're dentists, they're doctors. Like,
yes,
wake up, people. That's what I'm going to say.
Yes, they can do it. They just need to know that they can. They're nervous. I want them to know that they can be competent and confident and compassionate. They can do it.
Well, thank you again. I really appreciate it. And I always finish the same. Have a good night. All right.
Thank you so much. You too, Nicholas.
All right. Take care.